So this is Dr. Corey Maas, and we're describing the small fatty deformity study that we have, and this is a very good subject. I'm going to have you turn a little bit toward me here. She's had prior lipo, which is this kind of deformity is common, and what we've determined, because we see such quite dramatic improvements even with a single treatment with Kybella, is that it is better to kind of mark the areas that we've already taken photos without markings, but she's got this little dip, and so with I'm marking the dips or the low spots, and then if it's not super low but just a little one, I'll do a dash line. But she's got a big bump here and then a big dip where the liposuction was sort of incomplete, and then that leaves this small fatty deformity on her hip. And these are the kinds of deformities which there's not super great scales yet, which we're working on scales. I can see that, there's another dip right here that's a little less dramatic, and so I'm going to mark that, and then one right here too. So I'm going to mark these. And so the challenges in these studies that we found have been that while we see tremendous improvements with people, they're very hard to quantitate. And so the Vectra, some of the other systems that are out there that companies are using are nice ways of doing it, but this is also a nice way, and we can treat this roll too. This probably wasn't treated before, but there's a dip right here, and we can treat the rolls here. So in the study, one side is going to be a control side, and the other is going to get which is saline, and then the other side will be getting the Kybella. And so we're going to treat these, and we see rather gradual changes. Well, they're dramatic changes, sometimes so much so that people, we had a hard time seeing where we had treated, which bumps we had treated on the side of the active drug. But marking this we found was extremely helpful. And then you can kind of squeeze your cheek a little bit. And so we can see sometimes some of these little dimples better when they squeeze like this. And some of these smaller fine dimples are certainly things you can treat, but are a little outside the scope of the study. For example, she's got a little fatty bump right here, which you could theoretically treat too. And it's not as dramatic like when we do a bump like this with lipo. It would be possibly with tunnels or depressions, and it's rather gradual if you take a bump like this down. So her buttock area is relatively smooth, and then squeeze your cheek, and then you can see some of these finer dimples. And this gets into the study parameters that we're doing on many patients that have these little irregularities. And outside of these injection techniques that dissolve fat, this is really hard to treat historically, but I do think we really are at the beginning of a true cure for what is typically considered cellulite, where it's just lumpy, bumpy cottage cheese sort of thing. And so I haven't circled the green because we're going to do these two hips as markers that you can relax now, that are areas where liposuction was done. So I can turn her till she's a lateral too, but this part, and it's just lighting is such an important factor in this. So I'll turn you a little bit more to the side, and then she's got a depression clearly here, and this depression actually becomes more of a dotted line, and this whole zone here is elevated, if you can't see that on camera, with these little dips in the middle. And so this is the zone that we would be treating, and then you can see the dip. So I'm going to go just inside on both sides of this, because there's another bump right here. And so anywhere there's a dip, there's a bump adjacent to it, which is sort of a good rule of thumb when we're treating this. And high points often will do this a lot like lipo, where you can make concentric circles around the highest spots here. So a lot of people mark liposuction like this. I don't do body lipo, but except for fat transfer. But these are the ways we do it with the Kybella. We measure the area of these. We try to get some sense of volume too when we do these things. And so because the improvement that we see doesn't just make the surface area smaller, but it in particular makes the fat volume smaller, and we'll rate that as small volume or large volume changes. And if we can get this bump, and then I'm going to turn you back toward me this way a little again, and these bumps, these irregularities from her lipo smoothed out, I think she'd be very happy. She'd also be a candidate, obviously, for the buttock treatment, but in this study, we're going for relatively symmetric changes, and now this has been marked with high points and low points. One side will be control, that's saline, one side will be the deoxycholate, and then we're at 40 some subjects now, almost 50 subjects actually in the study, so we just have a few more to go, but I wanted to just talk about the things that we found were really important in marking the areas, because the improvements were so dramatic that it was often difficult to go back and find the spot. So once you mark it, we take pictures, and now we can go back and reference those spots where we've treated patients and make sure we're treating the same areas, even if some people are vastly improved with one treatment alone. So it's quite a dramatic improvement. So this is relative symmetry on the other side. So we treated the left side now, and then I'm gonna treat the right side. And this, a lot of these, this really represents volume. So this is the high point. And again, she's got this sort of deformity from previous liposuction where some parts were really dips, and then other parts she had bumps left. And it's the same thing with this area right here in the inframammary fold. On the other side, it's almost gone. It's 3 little lines, but on this side, it's quite large. So this may be one of the main uses for these products, is just to help with symmetry post-liposuction or post-cool sculpting or other interventions that are fat-destructive mechanisms. And so I'm going to start at the beginning here at this epicenter and the high point, and do a little bit bigger doses with a fanning technique. So this is really treating buttock dimples, and we're doing that with Kybella. There's a dip and then there's a bump. So when we're treating those, and then this is the gluteal fold, but a lot of times we get this sort of banana roll below it, and we can treat that, which I've done almost completely. And this is with deoxycholate or Kybella. And it's actually, in our case, part of the study we're completing. And we've got nearly 60 subjects enrolled, and are seeing really statistically different improvements between the treatment side and the side that is the control. That doesn't mean I have other patients that are just paying for the treatment. They don't want to be in the study because of the placebo side. But everybody in the study gets to get the treatment for free. And you can see we've already marked this in the circles where we have this. The red is where the dips are, the green is where the bumps are. So, and then even the smallest, I'm going to turn just this way a little bit, even the smallest of little bumps, which you can barely see here, even with this, are little bumps that I've circled that we can bring down, so that the overall, she's got nice legs overall, so, but these little bumps take away from that. So we're going to get rid of the bigger bumps, and we're going to get rid of the the smaller little bumps that are standing there too. And I'm almost done with this side, so. Probably one treatment with these small ones, at least in our experience in the study, if this is the active drug side, but in practice we're assuming that it is, then these little very small elevations will be better after a treatment, and then I'm going to turn to this one just a little bit. And the bigger kind of banana roll treatments might take 2 or 3 to get them to smooth. This dimple will probably be gone in our experience with one treatment. And so that's a nice outcome for someone that's got nice legs and just small little things to treat.